Okay, good morning everybody. I think we'll make a start at that point. So I'll just spend the first few minutes, first of all, just welcoming you all up to Inverness and the Highland Campus, University of Stirling, for this opening seminar, part of the ESRC funded seminar series on the social sciences and nursing. I'll just give you a little overview as to what the seminar series is about, to put into context the presentations that you'll be hearing through the rest of today. Before that, just the usual administrative bits and pieces. So no fire alarms planned for today. If there's a fire alarm, we need to get out. Assembly points just on the grass in front of the building. We need the toilets. There's toilets through that door and just round to your right. So having ticked those things off, one other thing I should mention, if you're wanting water cooler just outside the door there. So having ticked off all those bits and pieces, let me give you a little overview as to what this seminar series is all about. So it's really, the story really started a couple of years ago. I'm Iain Atherton. I'm a geographer. I did a PhD in geography at St Andrews a few years ago. Prior to that, I trained as a nurse. I worked in the health service for a number of years. Worked in overseas aid. But I did my training at a time when people were doing vocational courses that involved working on the wards, learning largely on the wards in small colleges of nursing. And over that time, there was a shift from those small colleges to universities, and the intention that nursing would become much more of an academic subject. So as a result, I did a PhD, eventually moved back into nursing, back into lecturing in nursing, and moved up to the Highland Campus here a few years ago. Then I was joined by my colleague Richard Kyle, and we've had many conversations over the last couple of years. Richard himself is a geographer. He did his PhD down in Glasgow a few years ago, worked in research, various health research areas over a few years, and then looking for a lectureship, we got into nursing and moved up here. It was a really fortunate coincidence in a sense that we had two geographers based on this campus. We were really able to throw ideas around, thinking about our subject and our discipline, and more generally the social sciences, what a contribution that they might make to nurse education. So those conversations developed over time, and we started thinking about, well, what could we do to actually sort of move this agenda forward? The social sciences are touched on in nurse training to a greater or lesser extent. Some institutions have become very aware recently. Some universities really do make quite considerable use of the social sciences, but it's very uneven, varies considerably from one place to another. And the rationale behind the use of the social sciences is very varied. The theoretical thinking behind what the social sciences might contribute is not particularly well developed. We got the sense of in our conversations. So those conversations moved on. There is an annual call from the ESRC for funding for a seminar series, and we thought that's an opportunity to widen those conversations. And I think that that's a key theme about what this seminar series is all about. We started thinking about the opportunities that might arise, and as a result of that, we thought, well, really to make this have impact and really widen out those conversations, the next step is to start developing a team to develop this seminar series. This picture shows the sort of core organising team, to whom I'm very, very grateful for all the contributions they are making, and you'll have the opportunity to meet some of those through this morning. So we've got Sarah Donetto on the end from King's College, Sarah's colleague Glenn Roberts, second from the left here, from the RCN Research Institute we've got Kate Sears, and from the University of Nottingham, Stephen Timmins in the middle, and our colleague from our Stirling campus, Sally Hoare. And so we got in touch with these people, and one thing led on to another. We read one of Stephen Timmins' papers he's written on the use of sociology in nurse education. We got in touch with him, really enthusiastic. We started having regular meetings using a Skype-like program, and again, the ideas really started to mushroom. The possibilities of what the social sciences could offer to nurse education really began to develop, as well as the manner in which a seminar series might contribute to that. And really, this seminar and the seminars that will follow that is kind of the next step on from that, linking in a lot of other people so that we can really widen those conversations, really start pulling in a lot of ideas. The social sciences are so diverse. Today we're focusing on human geography. The next seminar will be looking much more at ethnography. Kate Sears down in Warwick pulling that together. So progression over time, pulling in lots of ideas, and to really begin to think about the theoretical reasons and opportunities and possibilities that the social sciences offer. We think it's really important that we pull in a wide diversity of people. And absolutely thrilled that you've all been able to, just talking to you just now, some of the adventures you've had making your way up to the far north of Scotland. Really appreciate the effort that you've all made to get up here. There's some really key people, people who have already really started thinking through, for example, sociology and what it might offer. So Benny Goodman, who will be speaking as one of the summarisers this afternoon, come all the way up from Cornwall, based at the University of Plymouth. He's already started writing about the sociological imagination and how that might be used within nurse education. We've got students from various universities. Gerard Brennan from Napier down in Edinburgh. Some of our own students will be joining us a little bit later on this morning, taking in and thinking through, is this useful to them? What is their take on this? What are the opportunities that they see? And those students are going to be coming to each of the seminars, and some of those students will be meeting together at the University of Nottingham towards the end of the series to really pull together some papers to take forward to our final seminar in London. So nurse educators, students, but also importantly social scientists who have been working in health but not necessarily connected to nursing. So my colleagues Mike Kesby and Matt Southern from St Andrews, for example, people who have been working in health geography and whose ideas can make, I think, a really important contribution to nurse education, pulling in on fields that perhaps have not been drawn on to the extent that they might have been. So again, a diverse range of people that we hope are going to be pulled together through this seminar series. So conversations, I think, are a key theme as to what this seminar series is really about. So as I mentioned, the way in which we get these conversations going is firstly through 6 seminars starting today in Inverness. The first year is really about the theoretical ideas. So today, thinking about geography is just an example of the social sciences. Moving on to Warwick in a couple of months' time, where, as I mentioned, ethnography is going to be the main focus. Before moving on to King's down in London, where Glenn and Sarah, who I mentioned a few moments ago, are going to be looking at case study and looking at Mid-Staffordshire and thinking through the ideas that have come out of the first 2 seminars. What difference might that have made to that particular situation. We then come back up to Scotland, down to our Stirling campus at the beginning of next year. where we sort of shift the focus slightly. We start thinking from nurse educators' perspectives. Given the ideas that have been pulled forward, given the perspectives, given some of the thinking that has come out of those first 3 seminars, what's their take on it? What opportunities do they see? What are the barriers? How might those barriers be overcome? We then move on to the 5th seminar, which is really about the students coming together, those students who have been able to get to the open seminars, getting them together, and as I say, getting their perspectives, getting their take on, is this something that will be useful to them, before our final showcase meeting, which again Glenn Sarm are pulling together down in London, which will be happening in a couple of years or so time. We really hope to get across to the nursing profession just what ideas have moved forward from the seminar series, and really try to give impact to these seminars. But it's not just about the seminars. We're really keen that this taps into nursing more widely. So as you've probably come across, we've set up a website. I say we, Richard's the technical guru, did a terrific job in setting up this website. Up till this point, we've really been using that website to raise the profile of the seminar series. But as of today, we're going to be using that to a much greater extent to become a resource that we can use to put materials from the seminars, but also to again widen those conversations and widen those discussions. So we're going to start blogging through the website. We're really keen that some of you yourselves can contribute to that, so that we can really start having discussions and those conversations, not just in the seminars themselves, but much more widely. So we're going to be blogging, using Twitter. Again, we've been using Twitter already. I'm not sure I've quite got my head around it, but up to this point it's all about raising profile, but as from here on, it's going to be much more about having those conversations. So again, do contribute to those, and again, I think we can really move some of these ideas forward. There's the seminars themselves, which I've already mentioned. So let me move on to thinking about the seminar series, to really thinking about where nursing is at the moment. And in terms of the context, I put up on this slide just some of the issues that at the moment are writ large around nursing. So there is, I think it's fair to say, there is a lot of angst within the nursing profession for various reasons. The most notable one in recent years has been mid-Staffordshire, a situation where a hospital was identified as having very high death rates. Public inquiry was set up, and as a result of that public inquiry, what really came across, and Robert Francis, the QC who led that inquiry, stated in his report after the first inquiry, but what really struck him was that many of the issues in mid-Staffordshire were not about technical medical interventions, but they were about basic nursing care. So that raises all kinds of issues for nursing and nurse educators, which are contributing to some of our thinking around this seminar series. And it's not just been mid-Staffordshire, there have been all too many of these scandals. Part of the context within which they are sat is this shift that I mentioned from being vocational learning, where you learn on the wards, to being in an academic institution, being based in the university. That shift happened about 25 years or so ago. Am I exaggerating it? About 25 years ago that shift really started to occur, just after I finished my own nurse training. And the possibilities offered by that were huge. They really were quite considerable. The extent to which they've been realised is debatable, and reading the nursing press, there are some real critics who have suggested that we might have moved nurse education into the university, but the extent to which the academic focus of that has really moved forward has been really quite limited. Now, that's a debate, that's an argument, but that is there is that issue there. And again, within that context, is there something the social sciences can contribute? Can we draw on the social sciences in such a way as to move forward that that academic goal? But there are also lots of opportunities. I painted a very negative view over the last few minutes, but there are lots of positives as well. And again, I mentioned a few here. Recent study in the Lancet has very clearly demonstrated that having graduate nurses is associated with lower death rates on hospital wards. So the evidence, I think, for that shift into a more academic, becoming more academic, I think the evidence is becoming increasingly robust. And in addition to that, there's all these other opportunities that I've noted on this slide. Really dynamic students. I've been away from nursing for a number of years, coming back into nursing some 4 years ago. You're really struck by the enthusiasm of students. A lot of dedicated staff, often a point which is missed when we hear news reports of scandals and all the negativities around nursing. But there is a real genuine dedication there, which you really get across. When you're talking to mentors, nurses out on the wards who are mentoring your students, a lot of dedication, a lot of enthusiasm, and a lot of work going on within teaching. I think already this seminar series, for me, has really highlighted just how much good work there is going on out there. I mentioned Benny Goodman already, some of the work that he's moved forward, and people he's been having conversations with through the nursing literature. A lot of good work going on, but if we can try to bring some of that work together, provide a focal point, then I think that will be a real achievement for us. The social sciences, as I've already mentioned, there's so much work going on around health geography, health economics, health sociology, lots of dynamic things happening. Issues around big data, the opportunities that raises, opportunities that potentially for the nursing profession. But I think also spaces that health geographers and sociologists, real opportunities that some of the exciting and dynamic ideas that are constantly evolving out of these disciplines can really revitalise and make a real difference to nurse education. So hence we put together the proposal. These are the initial aims that we put on the application. These are sort of what's guided the ideas that we've been pulling together for the seminar series. When we first started flagging the ideas, quite a few people came back to us and said, well, what are the kind of metrics you're going to use to kind of judge and assess whether the seminar series has been a success or not. And that kind of rocked me back on my heels and got me thinking. But I've noted some of the things that we hoped might be achieved through the seminar series. I think the main one is those conversations, really raising the profile of these approaches of social sciences within schools of nursing, encouraging connections between schools of nursing and other social science disciplines. Within teaching, ideally, if we can contribute to making changes within curriculum in such a way that can make a positive contribution to nurse education. So, maybe modules based on the social sciences, or to which the social sciences make a real contribution. Potentially books, but just generally more of an engagement between nursing education and for nursing students. And research as well. I think the opportunities to make links between social scientists and nurse education, and especially the nurse educators who have already really started developing the social sciences, of which there are really quite a considerable number already. So these are the kinds of things that might come out, but the main thing is those conversations, which today is really a start. So moving on to today, Richard's going to introduce in a few moments' time our first speaker. And then it's a fairly flexible timetable. What we've tried to do with today's timetable is to create lots of space for discussion. So we've got discussants, my colleague Billy Lauder, is based on the Highland Campus, going to be acting as discussant for this morning and leading the discussion. And Ben Goodman, really appreciate taking forward the discussions this afternoon. So I hope you really enjoy the day. I hope you all those travails in getting up here all worthwhile. Like I say, really appreciate you coming. And at that